Welcome back to the Nurses Investing for Wealth mini-series podcast, Season 1. This is where I'm sharing with you the big picture look you need to be able to turn your nursing salary into work optional freedom once and for all. In this episode, I'm talking to you about toxic nursing culture. Not just toxic nursing culture, but more specifically how you can disrupt the death spiral if you're in it. I'm going to be direct and maybe a little dramatic for a moment. The nursing profession and American healthcare culture more broadly is locked in a death spiral of toxicity that's hurting everyone involved. I know, dramatic, but it's true. First, before we get too deep, let's define what does toxic mean? Like, what does it really mean? Because it's not a colleague who makes you feel bad, a feeling of exhaustion, or a miserable feeling after work. That could be part of it, but it's more than that. So let's make sure we're all talking the same language. A 2023 article from MIT Sloan Management Review written about what's behind the nursing crisis identified toxic workplaces as having 5 traits, and I'm going to list them for you. Are you ready? Here they are. 1, disrespectful. 2, non-inclusive. 3, unethical. 4, cutthroat. And 5, abusive. These are the 5 overarching themes they identified after using AI to analyze 150,000 reviews written by nurses from the job recruiting site Glassdoor. While this doesn't describe all workplaces, these characteristics describe much of the modern nursing experience. So here they are again: disrespectful, non-inclusive, unethical, cutthroat, and abusive. I can picture you nodding your head along like you totally get it. It's likely you've either survived this experience in the past or you're currently in it right now. Enough of healthcare culture is like this that it doesn't even seem controversial to describe the modern nursing experience as a toxic death spiral. In the modern healthcare environment, a complex set of problems have put unprecedented level of pressure on a system that was already dysfunctional and failing. Interventions that have been put in place to manage the pressure have made the situation worse, and there doesn't seem to be a clear end in sight. The unprecedented pressure, of course, came from the impact of the pandemic. However, the reason it pushed the system to the brink is that COVID-19 hit a system with existing chronic problems, which was already sitting on the edge of crisis. The long-standing nursing shortage was one pre-existing issue, but so was the demographic problem. When I went to nursing school 25 years ago, nursing professors warned me about what was going to be happening right now. The aging workforce retiring and a significant surge in the demand for nurses, primarily driven by the needs of the vast baby boomer population. Boomers are the biggest generation alive. They were until the millennials recently surpassed them. And now they're leaving the nursing workforce at the same time as needing an increased amount of healthcare. No expert could have known that a pandemic would hit when it did, but people have been talking about the most important challenges in the American healthcare system for decades. Here's a list: disorganization as a result of our decentralized private system, dissatisfaction among the workforce, a general shortage of staff, social issues leading to distrust of the healthcare industry, increase in workplace violence against healthcare workers, the pace of change and the difficulty for systems to integrate new technology, rising costs, administrative waste, and failures for patients. None of these things are new. We've had this data for years. I studied this back when I was getting my Master of Public Health in the late 2000s, and nothing has changed much since. The American healthcare system is unhealthy, expensive, and it achieves poor results. Our country has the lowest life expectancy at birth of any comparable economy in the world. Look up the data on the OECD or the CIA if you want. What's absolutely crazy is that the cost of healthcare is dramatically higher in the US than any other country, too. It's an oversimplification, but it's safe to say that we're paying more than other countries and getting worse health outcomes. The pandemic crashing into an already stressed system has created a nightmare scenario for healthcare workers on the front lines, leading to a crisis of departures from the workforce driven by burnout and trauma. I talked more about this in earlier episodes. I hope that you've had a chance to listen, or if not, you can go back and listen. It's not just nurses who are recognizing this. According to a poll of hospital leaders, staff nurse retention and burnout is the number one problem organizations face. Quote, 90% of the CEOs surveyed cited nursing shortages as a particularly acute pain point, unquote. I wonder if any of them talked about the fact that there are 1 million qualified nurses who have decided not to work in this field any longer. Despite leadership recognition, many organizations have responded to the nursing shortage with interventions that have made the situation worse. It's a familiar dynamic. Floors are short-staffed, so nurses don't have the resources they need to do their jobs. Managers decline PTO and push people to mandatory overtime in an attempt, maybe not always mandatory overtime, maybe just overtime, in an attempt to fill staffing gaps. Staff start to burn out, so managers offer up self-care skills in an attempt to maximize the amount of suffering they can endure and make it a you problem, not a me problem. Managers will hire travelers at a much higher cost to staff up. This creates inequitable workplace conditions, and now you have nurses working in the same area with the same number of years experience doing the same job, but they receive dramatically disparate pay. Costs, predictably, go up. And now you have administrators fighting against requests for raises and better compensation, despite the fact that workload and stress have increased dramatically for frontline staff. Union activity increases, hospitals go into union busting mode, the relationship between staff and administration gets more toxic, and nurses get fed up and eventually quit, making the situation on the front lines even more difficult. The death spiral continues. It's the toxicity, stupid! When you work on the front lines, you can get the impression that administrators think that all of this is going to work out somehow. Keeping staff pay down and hours up and pushing nurses towards the idea that all of this is going to be okay if they just get more efficient and better at self-care. The fact is, though, all of this ultimately makes nurses perform more poorly, hate their lives, and eventually quit. Increased workload, insufficient staffing, poor communication, and lack of support leads to mistakes, apathy, and frustration. It's a well-researched dynamic. Higazi and colleagues say it perfectly in their research paper, quote, inadequate work environment and negative perceptions are counterproductive to providing high quality and safe healthcare, unquote. In other words, academic research exists supporting that happy and safe nurses are better at their jobs and more productive. I can practically hear the collective groan at the utterance of the word productivity. But stick with me. The pursuit of productivity at all costs actually leads to a long-term decrease in productivity because burnt out and unhappy workers produce less. Because our business is life and death, toxic work environments produce very complicated moral questions and costs. If there's any question about who suffers alongside nurses, it's clearly, can you guess? Can you guess who suffers when nurses suffer? Yes, it's our patients. I pulled this quote from Dal Aura and colleagues' research paper. Quote, among the outcomes of burnout, we found reduced job performance, poor quality of care, poor patient safety, adverse events, patient negative experience, medication errors, infections, patient falls, and intention to leave, unquote. By the way, if you want me to send you this quote and reference so you can write it into your next performance review, get in touch. I will be happy to send it to you. Nursing salaries are increasing in the midst of all of this mess, and they should. That's probably leading nurses to stick around in their jobs a bit longer. However, survival is not just about pay. During the pandemic, nurses knew they were in crisis mode, so they tolerated unacceptable conditions. And conditions either didn't improve or have been slow to improve after the pandemic. Emergency stopgap measures were extended into what seems like unacceptable permanent policies. We leave the stress and physical demands of our job, then go home to other stressors and more caregiving. It's pushed a lot of us over the edge. We're in a phase where short-term thinking is creating long-term problems, causing active harm to both staff and patients, and undermining the future of healthcare. So let's talk about what a non-toxic nursing environment looks like. I know you're asking, well, yes, but what can be done? Well, I've got good news. A lot can be done. While it's true that poor patient outcomes are associated with toxic cultures in healthcare, the opposite is also true. Workplaces where nurses are satisfied and happy are safer and have better patient outcomes. The factors that contribute to nurse satisfaction and retention are relatively clear. And here they are: healthy organizational culture, leadership support, adequate compensation, and manageable workload. Other research extrapolates out a bit. The review by Higazi et al. Cited a sense of autonomy, environmental control, healthy relationships between doctors and nurses, and organizational support. Also, safe staffing levels, competent managers, good communication in the workplace, responsive administrators, engagement with decision-making in the workplace, and meaningful recognition of authentic leadership. Factors outside of work also contribute to nurse satisfaction and retention, because our lives are not just our jobs. Our lives, our identities are not just being a nurse. Things that happen to us outside of work are important too. Healthcare workers are known to be happier when they experience feelings of altruism and the chance to help others. They're better off participating in recreational activities, taking vacations and breaks, spending quality time with their friends and family, and getting good quality sleep. Are you asking yourself if these conditions actually exist anywhere for healthcare workers? As with everything, there's a broad range. The MIT Sloan Management Review has created a tool to make this more transparent. They call it the Nursing Satisfaction Index, and nurses everywhere can use it to review nurse experiences at 200 large healthcare organizations across the U.S. It's really interesting. I'm going to link that in the show notes, and I definitely recommend you check it out to see how your organization compares or to help you along on your next job search, maybe. But getting back to the factors that increase nurse satisfaction and retention, if you put all these together, it's easy enough to get a picture of what healthcare organizations should do if they want to improve patient care and staff satisfaction. When it comes to nurses, organizations should keep their wages up, their hours down, enact safe staffing ratios or manageable patient loads for nurse practitioners who are working in the clinic, minimize the amount of suffering nurses have to endure on the job, increase their autonomy, and find avenues for meaningful input into decisions that affect them. Organizations should work on building relationships between leaders and nurses that are supportive rather than adversarial. They should consider interventions like increasing PTO, allowing nurses to lower their FTE as needed, providing wages that are commensurate with other comparable professions, minimizing the pay gap between healthcare administrators and frontline workers. Here's what organizational leaders should not do, according to Saul and Saul, the authors of the Sloan MIT Management Review Study. Quote, "What leaders should not do is ask nurses to work harder and endure more frustration and stress while failing to understand and address the organizational factors that make life miserable for many of them." Unquote. As I talked about in the last episode, frontline nursing is not a career that's sustainable for 40 years. And I mean this for all nurses, nurse practitioners, CRNAs, nurses at the bedside, all nurses. So pressure is gonna increase for leaders to create environments that facilitate career longevity. But what about when change is slow to come? As nurses stuck inside those toxic environments, we need solutions now. We cannot wait years and years for this to get worked out. Am I right or am I right? Because it's not our job to solve these problems. It's not your job to solve these problems. Administrators and even colleagues may make you think you are responsible for resolving these problems, but unless you are a C-suite leader, a policymaker, a union organizer, or a Department of Health leader, you are not responsible for fixing the problems in the healthcare system. You are not even capable of it because you do not have the power to do that. So I want you to walk away from this episode knowing that while all that political and organizational work gets ironed out by someone whose job it actually is, you have a more meaningful action to take, one that you're fully in control of. And that's making sure to build your own safety net. Take the steps you need to become financially literate and develop your money skills so that you can decrease your financial stress. End your dependence on working for a paycheck to cover bills. End your reliance on your employer. And prepare to leave or retire early when you need to, with or without your employer's help. Get your organization's support. Cash in your continuing education dollars on my #1 State Board of Nursing approved financial literacy course. Put in your request for continuing education time and reserve that time to plug into an evidence-based money system that's proven to build your safety net. That's how you can escape toxicity and entrapment. And if you are a leader at an organization committed to taking meaningful action to end nursing toxicity, encourage and support nurses to get inside this program and set up their financial independence. Because now you know it's best for them and it's best for your organization too. Equipping nurses with the skills they need to be able to work when they want, if they want, means you're also actively taking steps to create a toxicity-free environment where nurses choose to spend their time doing what they are experts in, helping patients at your organizations. When you keep them there, you keep the lifeblood who is doing the essential work, composing the backbone of your organization. Now, for those of you asking, but wouldn't it cost too much to end the toxic nursing culture death spiral? To that, I say, that is the wrong question to be asking. The real question is why more resources are not being invested in ending the toxicity. In a country that leads the world in healthcare spending but has worse outcomes, I feel just fine asking why so little is being invested in solving this problem. And that's the next episode, along with how nurses and advanced practice nurses like us are responding to the toxic nursing culture with our checkbooks. If you're ready to take steps toward financial literacy, you're here for a reason. Come over to my website, learn.nursesinvesting.com, and take my free training. Learn how you can set up a future where You work part-time or not at all. You say no to that dangerous assignment. Take unpaid time if needed. When your PTO is declined, you take it anyway. You pay yourself if you need to. You refuse to bend to pressure to do more. You speak up for patient safety without fear of retaliation. Breaking this cycle is what Nurses Investing for Wealth is all about, so you can do the things that mean the most to you now and stop putting them on hold. You spend more time on hobbies. You invest in yourself and upskill without taking on extra debt. You start your own business, maybe. You travel and explore as much as you want. You spend more time with family, so you stop missing out on these most important moments before it's too late. Click the link below in the notes or type in learn.nursesinvesting.com into your internet browser and start now with my free training. I'll see you over in the next episode where we'll be discussing how nurses and advanced practice nurses are using the resources they have to respond to the toxic nursing culture. And they're finding ways to use financial literacy to make their nursing careers sustainable. I'll see you there or in the free training, maybe both. I'm glad you're here. Together, we're turning one nurse's financial independence into another nurse's power. See you next time.